All right, welcome everybody to the Organizational Health Literacy Breakout Session. We are thrilled to have you here with us, and we have quite the agenda and presentation for you to come. So I'd like to start by introducing our session's moderator and the lady at the helm of this entire pledge program and the seed grants, Dr. Melanie Stone. Dr. Melanie Stone directs the Community Service Learning Initiative program through the Center for Medical Humanities and Ethics at the University of Texas Health Science Center at San Antonio. She's adjunct faculty at the University of Texas of Public Health San Antonio Regional Campus and is actively involved in the community, serving as co-president of Health Literacy Texas and on the governing board council of the Texas Public Health Association. Dr. Stone is an alumni of Leadership San Antonio and Leadership Texas, and why she's here today, she is co-investigator of Health Confianza, where she leads the Health Literacy Pledge Program and Seed Grant Program. Melanie?
Thank you so much, Elizabeth, and welcome, everybody. It's so great to see you here. I'm going to stand up here because these lights are blinding. If you haven't been on stage, it's like, whew, it's really hard to see. I know it's getting close to lunchtime, so thank you for hanging in there. Don't worry, we will not keep you too long so you can get out there to lunch. But we really appreciate your taking the time to come to this session and hear about the wonderful work that your community organizations here in San Antonio are doing. I'd like to start off by having a show of hands of anyone in the audience who is part of a pledge program organization, whether you are part of the team or not. If you can raise your hand. Okay, so there's a few of you. And so for the rest of you who are maybe not as familiar with the program, I'm going to start off the session by just taking you through a few slides to orient you to what we're going to be talking about, and then we'll get right into the Q&A, the most important part, with our panelists. I will wait to introduce them until we get to that part, so it's fresh in your mind. Next slide. So these are our Health Confianza grant acknowledgements, so we can go ahead and skip over that. So if you were in our earlier session, you heard the orientation to Health Confianza in general, which is a multi-level health literacy program aimed at these different levels. So the community, the healthcare providers, the health educators, the community health workers, even students in the health professions who will be our future healthcare workforce. And then finally, we have the organizational level, and that's what we're going to be talking about today. Next slide. So I just want to orient everyone. You know, I don't think we really defined health literacy in this summit so far. You all are probably aware of what the definition is, but basically, health literacy in general is the ability for, it's a person's ability to find, understand, and use information and services to inform their health-related decisions for themselves and their families. As Dr. Rosenfeld mentioned earlier, that's putting a lot of onus on the individual and their capacity to be able to navigate the complex healthcare system. Fortunately, there is now a recognition, even at the federal government level, which is one reason why they issued this grant award, that it's more than an individual's ability, right? It's also the complexities and the demands of the healthcare systems that we have created. It's not easy to navigate for anyone. You know, even if you have pretty high health literacy, it's still a challenge. And then you compound it with all of the other factors that may make it more challenging. And then, you know, what I like to think of is, well, what is the point then of your organization providing healthcare services and education if the clients and the patients aren't able to really use it? So we do have organizational health literacy now in focus, which is a good thing. It does require the organizations and systems to take responsibility so that they can make their information and services easier to access. easier to understand, and easier to use. Next slide. So when we got this award and we were conceiving the different strategies for the organizational health literacy, none of us really had that experience or expertise in that level. We were mainly always focused on the community level or the provider training level. And so we dove deep into this, and we had the notion that we wanted our organizations to take a pledge and take a pledge to help improve their services. But then what did that really look like? Well, we looked in the literature. We did not find any organizational health literacy pledge programs anywhere. So we decided to create it from scratch. And what was really important to us was the fact that COVID really brought to light that a lot of people in our community, as has been said many times today, don't use or necessarily trust traditional health care. They do trust their local churches and community centers and food banks, and a lot of time, that's where they get their basic health education and basic health services. So we knew that it was really important in this initiative to, of course, include clinics and hospitals if they were wanting to join this, but also really let community-based organizations know that, hey, you should be part of this too. All right, next slide. So we conceived a pledge program. I have to say I was a little bit thinking about how our city of San Antonio was also evolving to become a trauma-informed care city, and I liked that notion, and I was really hoping that organizations would want to do this maybe as a complement to that, which one of our pledge organizations did, or just have that notion in their background that, hey, let's take this extra step. But we really didn't know whether it was going to be something that any organization wanted to spend the time on. We did budget for 10 organizations to be part of this pilot, and lo and behold, we got 10 applications, so it worked out perfectly for the pilot. Once the organization was accepted, we asked them to identify a team of 3 to 5 staff members that represented diverse levels, some people who were on-the-ground health educators, as well as administrators and supervisors and decision makers, so that we kind of reached different levels of that organization. And then to achieve the culminating pledge certificate that says you went through this program, we first asked them to conduct a pretty comprehensive self-assessment of their organization. We used a tool called the HLE2, which is Health Literacy Environment for Hospitals and Health Centers, which doesn't include community-based organizations, but that was part of this unique program, was testing that tool to see if it could indeed be used by community organizations, and we found that they were able to use it beautifully. So that was one finding that we had. So after they did this assessment, which took about 2 months, then I met with each organization to identify about 3 short-term actions and 3 long-term actions that could be their next step. So, they see the assessment, they're seeing what they did well in and what they could improve upon, and we turned that into actionable steps, which took them into the 8-month learning collaborative. So this, and I'll describe the format of that in a minute. So through that collaborative, they learned how to now create an organization health literacy plan that would transform their policies and practices to actually integrate these new goals into their organization. Of course, today we're presenting our findings at the summit, and then I'm going to be asking all of the organizations to do a follow-up HLE2 in about a year to see the impact that this pledge program had and how they are taking it to the next level. We also have a media campaign going on, which is really to educate the public. If an organization has this health literacy pledge certificate hanging in their office or on their website or in their email signature, what does that mean for me? Well, then, that campaign is to let them know, well, you're going to get respectful care. You're going to know that this organization actually is going to go above and beyond to make sure that you walk away from their services knowing exactly what you're going to do. Next slide. This just goes over the actions. This is an example of what that looked like. So you can see it's very detailed priority actions that each organization developed for themselves. It was unique for each organization, and then they turned that into a health literacy plan that was actually developed by the CDC. So that was the template we used. By the way, you can learn about the details of every organization in the poster session that's going to be taking place right after this. So if you haven't yet noticed, there's a lot of posters out there. Each of our pledge organizations will detail for you what they're going to be doing. So it'll be interesting to talk to them. Next slide. So this briefly, the Learning Collaborative was an in-person. Thankfully, we were able to do that after COVID. We were able to meet together over an hour and a half each month. We provided lunch for the groups. We also brought in some health literacy expert mentors, people who were from around the country who actually had been doing research in organizational health literacy and were able to help guide. Each mentor was assigned 2 to 3 organizations to help them through this process, right? Because it's, it wasn't necessarily an easy thing to do to take their priority actions and turn them into a workable plan. And so they were there to help them throughout the collaborative. We talked about some things that they needed to know in order to do this. There's things like the 10 attributes of a health literate organization. You can Google that. There's class standards, which we've been talking about today, the culturally linguistic and appropriate standards. So we've helped educate them on all these different aspects and really just how do you make organizational change. All right, next slide, please. Okay, so I think this is a really crucial slide because it describes the benefits to the organizations. We put a lot of thought into this because, again, we weren't sure if they were going to want to take the time out of their very busy schedules. They have a lot going on, especially the nonprofits, the clinical practices, all of them. And so one of our carrots was providing that expert guidance, which was provided by our Health Confianza team, as well as those 4 experts that we brought into this. We did provide funding to them to kind of offset some of the costs that were going to maybe be involved in their health literacy initiatives, as well as compensating them for their time and effort of spending time on this and away from their other job duties. The media public attention, so they don't know yet, but they're going to get a really nice certificate today. So there you go. It's going to be something that they can hang in their offices, and we will also provide other electronic media and public awareness of this. Now, the networking, that ended up being one of the more important aspects of this program, which was something that was kind of new to us. Like, we weren't expecting that to be so important. But when these organizations wanted to make these changes, they really wanted to learn from each other, and they loved learning about each other's resources that could benefit their clients. And so we saw a lot of that happening. We want to continue that, and so we're going to be talking to our organizations about ways to continue that network that they've now created together. And then finally, looking at sustainability, we did want one team member to be able to take what's an online health literacy specialist certificate. Any of you can take it if you're interested. It's a pretty rigorous online certificate process, but it's really good at giving you just an overview of all aspects of health literacy, not just organizational health literacy, but really anything that you might be needing or wanting to learn. It is valued at $2,000, and so we were able to provide that as one of the benefits to one of the team members with the hopes that they will now serve as a train-the-trainer for the rest of the organization. Next slide. So we don't have all of our organizations up here on stage with us today, but I did want to draw attention to who they are. So we have all their logos up here. We have the UT Health San Antonio Primary Care Center, which you're going to hear from Dr. Perez. We have Community First Health Plans, represented by Jessica Rios. We have Living Positive San Antonio. Jace is here to talk about that. Alamo Community Group. Tina will be sharing that. But then we also have Empower House. We have the Save Clinic, which Dr. Ochoa was speaking at earlier on the panel up here. We have SAM Ministries. We have a public education university, Texas A&M San Antonio, huge university, joined us for this effort. We have the YWCA, Corinne was on the panel earlier, CentroMed, and so these, again, all of them will be represented out there. Please be sure to go talk to every pledge organization. Last slide. And that's our group photo, which I notice is up here on the stage as well. So that's probably not everybody, but that is from one of our last sessions together. I'm going to pause here and just see if there's any questions before we get into our panel discussion. Any questions about the pledge program or how it worked? Yes.
Thank you so much for explaining. You mentioned about the training. It's self-paced, right? So do you know the time frame and what's the requirement? How long does it take in general?
Are you talking about the certificate training?
The certificate training.
I can't give you an exact time frame because it's a self-paced online program. There are 7 modules. They would probably take a couple of hours each. And then there's like a short exam that you take after the end of each module.
That was my next question, that I'm sure you take the exam and then you get the assessment of your knowledge. Thank you so much.
Of course, yeah. And it's through the Institute for Healthcare Advancement. You can just Google it and learn about their health literacy specialist certificate program. The idea behind it, by the way, is that they are trying to create a workforce of health literacy specialists who are going to be employed at different types of organizations, and they're starting off with this certificate. Okay, with that, I'm going to go ahead and read my bios for each of our panelists here, but I have to put my glasses on, so let's see. All right. So we're going to start off with Tina Armanda. She's the Deputy Director for Alamo Community Group, which is ACG. It's a local 501c3 nonprofit affordable housing provider whose mission is to develop, acquire, own, and manage affordable housing in a community environment that promotes resident education, self-sufficiency, leadership, and volunteerism through successful partnerships. ACG has been developing affordable housing for working families since 1990 and currently owns 1,411 multifamily apartment homes at 11 different communities throughout Bexar County. Jace Clower serves on the board of Living Positive and is a member of the Ryan White Planning Council. Jace holds several degrees, a bachelor's in secondary education, a master's in presidential history, a master's in theological studies, and a PhD in world history. Jace was let go from his position as a professor because of his HIV status. He then chose to become an advocate for the community and helps normalize the HIV conversation in the workplace. Dr. Myra Perez is a family medicine physician who works at the UT Health Primary Care Center, or PCC, at the Hill Country location. The PCC is a medical home full of trusted, experienced primary care clinicians who practice general internal medicine, family medicine, geriatric care, and pediatrics at 7 locations throughout San Antonio and the Hill Country, with more than 50,000 patient visits annually. Dr. Perez focuses on chronic care management and health promotion. Her work includes managing complex conditions such as diabetes and chronic obstructive pulmonary disease while still performing annual health screening for children, adults, and our geriatric population. Finally, we have Jessica Rios, the Director of Health Equity with Community First Health Plans. In her role, Jessica is currently working to lead Community First to Health Equity and Health Equity Plus accreditation. She leads the organization in data collection and creating strategies around removing social determinants of health for Community First members. All right, you ready, panelists? I'm gonna ask the first question. Why did your organization decide to get involved with a health literacy program? And I'm gonna start probably with our most unlikely suspect, which is the housing program. So Tina, can you begin?
Sure. Can you guys hear me okay? Okay, great. Yes, we were a little apprehensive at first, not knowing necessarily what the program was going to be like since it's the first group, and we're not a healthcare facility at all. We're a housing facility. But we were very eager because, as you heard earlier, Gloria mentioned at the panel earlier, residents come to our learning centers and they create a bond with the resident coordinator staff at the site. So they'll come to us asking all kinds of questions, many of them health related. So we wanted to be a part of an organization or a collaborative that would provide us with education on best practices and allow us opportunities to educate our staff on giving that information that was correct and accurate.
Thank you so much, Tina. And just to follow up with that, housing is increasingly recognized as a health determinant. Can you maybe tell us a little about the connection that you see between housing and health?
Absolutely. So our 11 communities in San Antonio, or actually Bexar County, target working families. So folks that make anywhere between 30% area median income all the way up to 80%. And they all range on different, the other part of the reason why we wanted to be part of this collaborative was the zip codes they mentioned earlier. We have 11 different communities, so a lot of our communities were in those zip codes. So our residents often are vulnerable populations to begin with. So we have folks who are leaving homelessness. We have folks who are seniors living on fixed incomes, folks who are on disability, refugees. We have a lot of, our population of residents have a lot of issues that are interconnected and woven, as you guys all know, with the social determinants of health. So not only, we understand the importance of housing and how that's interconnected into everything. So that's one of the reasons why we focus on resident services on site that are all free to the residents and their families. So we realize we can't be the experts with everything, so we connect with partners throughout the city any way we can to bring the experts into us.
Thank you so much. Jessica, not everyone may understand why a health plan, health insurance deliverer would want to participate in a health literacy program like this. Can you share your thoughts?
Sure. So prior to joining Health Confianza, Community First has really been putting an emphasis on health equity, how we speak to our members, and how we explain healthcare to them. We really wanted to join Health Confianza because we felt that it put an emphasis on our member-facing staff. Just to kind of go back to housing, it was really great to see a bunch of community organizations really come together as a pair. How many people in the room are really wanting to call their health insurance every day? Nobody, right? But we work with organizations like housing, smaller community-based organizations, hospitals, clinics, all around Bexar County and the 7 surrounding counties to ensure that our members understand the health care that they're receiving. So at Community First, our priority was really to care for our members.
And having healthy members is good for your business as well, correct?
Oh, yes.
Wonderful. Jace, HIV is a very complex condition to navigate and requires, I would say, a lot of health literacy on behalf of the individual. Can you tell us a little bit more about Living Positive and your reason for joining?
Living Positive is it's a social and a support group for those who are living with, as well as those who have been affected by HIV. And when we say affected by, we mean mothers, fathers, partners, caretakers, because those people need support just as much as the person who has HIV. And in our groups, a lot of health questions come up in our groups. They center around health issues. And we felt that we needed to express better information through health literacy. I'll say that after we started in this program, we realized that not only did we need to inform our clientele and our consumer base with better health information, we realized we needed to do it in different languages, because we have people out there that speak Spanish, we have people that speak Arabic. Matter of fact, one of our board members is an ASL translator, because there are people who are hearing impaired, there are people who are sight impaired. So we need to start adjusting how we disseminate our information in different ways, in different languages, whether it's spoken, sign language, or Braille.
Thank you, and that's an important consideration for all of our organizations, because you never know who your client or what they may or may not have, and so it's important to be very inclusive with that. Let's talk to Dr. Perez. Tell us about the Primary Care Center and why your very large practice here in San Antonio. Why did you decide to take the time to do this?
We just felt like it was too important to pass up. Because we're such a large healthcare organization within San Antonio, like you said, and we touch so many lives in the community, we just felt like we had to be leaders within this initiative, so that change that we made within our organization, within primary care, could ripple out as positive impact and positive change within the rest of UT Health, and hopefully within the rest of South Texas. We understand that the need is there, and as a patient-centered organization, we wanted to really make sure that we created every opportunity that we could to make our organization as user-friendly to our patients as possible.
That's great. I think we'll probably get more into that as we go in. I bet there was a lot of challenges to sort of transforming an established healthcare system. So we'll look forward to hearing more about that. I'm going to move on to our second question. What have you gained from being in this program? And you can answer from your individual perspective, from your organization perspective, or both. So why don't we start again with you, Dr. Perez. What have you gained from being in this program?
I think that what I gained was the language that I had always felt working in healthcare. All of us, or a lot of people who come into healthcare, as doctors, as PAs, as nurse practitioners, come in with a very positive idea, right, of what healthcare is going to be and what an impact you can make for patients and the community at large. But I think when you start working within systems, often you can become maybe disillusioned or disenfranchised with how much you are actually able to accomplish. So often you can feel like there's so many barriers within different systems, with insurance, with the organization you work with pharmacies, that really stand in the way of what is an optimal healthcare plan for your patient. So often I thought there needs to be systemic change. There needs to be more, because I spend 15 minutes with a patient, but there's so many other layers to healthcare that we needed to consider. So when I heard your video initially introducing the Pledge program, and you brought up the concept of organizational health literacy, it just spoke to something in me that I was like, I can take this frustration and this anger and change it into action. I can do something positive for my patients, not only by on a one-on-one basis speaking to them, but by changing systems around me to really work for them. So it was just such a great opportunity. I couldn't pass it up.
Well, that's great to hear. Woo, what a relief. And one thing that we made sure that we felt was really important was having leadership buy-in. And so with UT Health, what kind of leadership buy-in did you have in order, because it's hard for people doing the work to make changes unless their organization is backing it. So can you tell us about that?
Yeah, so this opportunity originally came to me from our primary care director, Dr. Ramon Cancino. He actually sent an email to me with a link of the information, and he said, I think that this is something that you could really thrive with. I think you need to lead this initiative. So when we started out the project and we were doing the assessment initially, I realized that because it was systemic and there were so many levels to it, that I needed to make this even more collaborative than just the 3 to 5 people that we had on our team. So I really reached out to our medical directors and our practice managers and people who worked within IT to help me fill out these assessments. And then you helped me collaborate everything into data and information. And it helped me really put it in a language that administration and that doctors understand, like talking about language and talking about speaking at different levels. I presented the data and I said, this is feedback coming back from you all. This is feedback that you gave me about the system. And these are opportunities that we have for growth. And this is our plan that you help us put together to make that growth happen. So it was about getting their input and their buy-in and just presenting it back to them and saying, this was your feedback.
So that's interesting. So, when you're working at an academic institution, maybe presenting data is the way to get that buy-in. Housing, what did you gain from this program, and how did you get your leadership support?
Okay, this is a good, yes, okay. So many things. I was like, what am I gonna highlight? Because there's so many interesting components to the program and being part of the collaborative. But ultimately, what we were looking for as a nonprofit, like many nonprofits, is the organizational health plan. It's an actual document that required that we assess our current programs and services. So it really did allow us to take an opportunity to step back and ask questions. If things were not working, why were they not programs, why were they not working? And it could have been as simple as the way we communicated with our residents via newsletters and translations, being able to provide translations for families who needed those services that we weren't currently taking advantage of. So it highlighted the things that we thought we needed to focus on. Our mentor also stressed to us a lot about getting feedback from the folks who are gonna be the end users of our services. So going out and talking to the residents multiple times in various ways, surveys, one-on-ones, casual conversations, to get feedback from them on what does work and what doesn't work, and how we could incorporate that into our strategic plan. As an organization, nonprofits, or small nonprofits, I feel, run with their goals every day. So they often need a strategic plan to keep them focused on what those goals, what's the end goal for them. So I thought it was really important, our coordinators and our staff on site work with residents daily, and they're doing the work. But I wanted to make sure we had it in written form for sustainability as well. I wanted to make sure that it was integrated, importantly, I believe, as a social determinant of health focus in our organizational strategic plan. And our board, we have a small board of community leaders as well as actual residents that that live within our community. So they were all on board and very eager, so we didn't have to twist any arms or provide data. They hear our stories from residents every day, and so they know what is impactful and where they see the needs. And so we're so resident engaged. We feel like we have our thumb on that. So telling them this project was gonna allow us to get more information that we could then bring to the organization's leadership and tell them, yes, the needs are the same or they're a little different. Let's focus on these goals, these strategies for the next 5 years.
So these strategies that we're talking about for gaining buy-in is true for any type of organizational change, not just health literacy. I did want to elaborate on the buy-in from the leadership. So as part of the application process, the senior leader at the organization did need to write a letter of support. So we knew right off the bat that they were aware of this, they were supporting it, and we also put how much time it was going to take and the commitment involved so that it was all very clear from the beginning. I also interviewed each of the senior leaders, and so I spent about an hour with them on Zoom, and I think that really helped me, first of all, understand what their objectives and goals were, but I think it also was helpful for them to spend that time articulating why this was so important to their organization, and because then they had to let their staff spend almost a year working on this. Jessica, can you tell us what the benefits were from the Pledge program? So maybe talk a little more specifically about the program itself so that our audience can know what it was that was beneficial to you all.
Sure. So for Community First, I think we gained organizational insight. The HEL2 assessment that we took really, it forced us to take an honest assessment of ourselves and our organization. And I think everybody here can sympathize with me. We don't like always taking a look at our organization and finding things that we don't like. So I would say that that's what we gained. In the long term overall, it also was a catalyst for our Health Equity Council to identify larger areas within the organization and other departments to ensure, once again, that we were providing our members with the best care. In terms of organizational buy-in, we had it at every point of leadership. I mean, right now, our president and CEO, Teresa Sapansky, is here supporting us within health equity and this Health Confianza. So I'm sure like the rest of you on these couches, but I am lucky enough that our leadership is very, very much wanting to ensure that health equity and health literacy are intertwined in our priorities and our strategies.
Excellent. Jace, what about you? What were the benefits to your organization?
I'm going to say that probably, she mentioned the HLV2, that was a benefit for us. The health literacy plan that we did was a benefit for us. But I think for me personally, and for our organization as a whole, probably the best benefit that came out of this was meeting these other organizations and meeting these other people who were trying to become just as health literate as we were. We were able to bounce ideas off of each other, especially in our breakout sessions. I think that's the biggest thing that we as an organization got from this, was we were able to talk to other people, get ideas from them, and it helped us grow in our health literacy. And as far as leadership buy-in, Mark, our founder, and he was the president at the time we started this program, was all for it. Matter of fact, he was all for it that he wound up going to all of our classes. And with each class, he became more supportive and more, go get this, go after it. And so I would say that overall, this program for us was a perfect fit.
Well, that's great to hear. There are plans of continuing this Pledge program, and so there may be organizations who, in this audience, who may be interested in pursuing it. Let's now talk in our last few minutes that we have, talk about what lessons learned, because this was it was new for us, it was new for you all. What lessons learned can you share that might be helpful for other organizations? And I'll just let whoever wants to start that conversation.
I can go. We learned so much, but the one thing I would say is, or not the one thing, one thing I will say is that however much time you can put into the collaborative, you will get 10 times back. So it really allows you to edit based on your organization's needs. Obviously, some folks are I'm going to say actually, everybody is super busy. So cutting out time to do a new initiative is going to be difficult. But I would suggest that we forced our staff and ourselves to work really hard and put a lot of time and effort into the process so that we knew that the end goal would be worthwhile at the end. So I would say don't come in assuming it's going to be a quick 1-hour meeting each month and that you're going to be able to go back and quickly come up with strategies and goals. Our mentors spent a lot of time with us outside of the actual meetings we had as a group and helped us create goals and strategies very specific to our organization. So it was very helpful, and I feel like we got a plan that is really useful for our organization. So it really is going to be whatever you can put into the program is what you're going to get.
Yeah, for community first, I have to agree with what you said. One thing I would like to add is that, you know, health literacy and health equity, they're ever changing, they're ever evolving. For anyone that is interested in joining, my words would be to encourage you to do so. This is really beneficial to your organization. As a payer, you know, we are not the experts in anything or in everything, kind of like you said. And so we rely on other organizations to assist our members to do things. So, you know, having the knowledge to speak to our members, to your clients, to our organization, to our community as a whole, it's really beneficial for all of San Antonio.
For us, I think it was a lesson that we learned was we can talk to our clients in a way that they understand the information that we're trying to get across to them. And again, coming back to time, is another thing we learned is we had to, even as busy as we were, we had to learn to set our time up so that we could get the work done. And it's right, it's not an hour a month, or it was probably 50, 60, 70, 80 hours a month, or maybe more sometimes. But it was worth it. In the end, it was worth it because we can talk to our clientele in a way that they can understand the information that we're trying to give to them.
I think for me, and it's a lesson that I'm constantly learning and relearning every day, it always comes back to the patient. My best teachers have always told me, if you listen, the patient will tell you their diagnosis. If you take the time to listen to what they're saying, if you build that communication and that trust and that relationship, they will tell you. So advice that I would give to anyone who was coming in and taking part in this collaborative would be don't wait until a certain step or until the end to get client or patient feedback. Start from the beginning because you will be surprised how much insight patients have when you listen to that feedback. A lot of our best ideas and a lot of our best feedback came from the patients. And not only that, it also builds a trust, I think. When they learned about our project and what we were doing and why we were doing it, we got overwhelmingly such positive feedback, you know, not only from the ideas, but also from the steps that we took. So it's just been overwhelmingly positive, but I think that's like the strongest message that I got from this whole thing is that it always comes back to the patient.
And wouldn't you say, Dr. Perez, that maybe in doing that, another benefit of asking the patients and the clients about what they want to see is also making them realize that you value what they have to say and that, you know, you respect what they have to say. So they're even beyond what they're actually saying, just the act of you doing it. I mean, for a doctor to ask them what they want to know more about is significant.
It's so powerful. You know, and I heard this mentioned on other panels too, you know, during the COVID pandemic, the healthcare organizations are often not going to be the most trusted or the first resource for a lot of people, which is what breeds misinformation and poor outcomes. So if we are building organizations that are getting their input and building that trust, well, that's so powerful. You know, we are building that trust with the patients so they can come to us and so we can address their needs and so they don't have to be scared to come to the doctor. You know, if you know your doctor's going to listen to you, that they're not going to be demeaning and that they're going to speak to you in a language that you understand, I think that they're going to feel more comfortable coming and then we can make even more positive impact.
That's an excellent point, and it also makes the work you do much more effective. Like I said at the beginning, why bother doing something if the recipient isn't going to be able to act upon that? All right, well, I was going to ask one last question, but I think in the interest of time, we're going to turn to questions from the audience, because that is very important. We want to hear from you all. And do we have, we got microphones running around, so raise your hand if you have a question.
Hi, everyone. I want to say thank you for sharing your experience. I think it's really important to provide that information to our community in a way that is receptive and taken into consideration of the communities we're serving. So unfortunately, my organization works outside of San Antonio, and this is a program that we would love to be a part of. So my question is, do you guys have plans of expansion?
I would say yes. We are working right now to, probably our next step will be to expand into San Antonio because, as you know, Health Confianza was prioritizing certain zip codes. Now we don't have our next funding set yet, so anyone who wants to fund us, that is an open call. But once we do, we will focus on Bexar County, and then, of course, we will also expand to the outlying communities as well, because that is a priority for us, for sure.
So thank y'all very much for y'all's feedback and context for y'all's experiences so far. So what I wanted to ask about is if y'all could explain a little bit more about that self-assessment process, because I'm just curious as to what strategies or game plans were used, because again, with that being at the beginning, if y'all don't do that objectively, then that whole next 8 months is kind of, for nothing almost. So I'm just curious kind of what those strategies or game plans were.
Yeah, and I'll start off by just giving you an overview, and then I'd love to hear what the panelists say about it, because that was, I was a little worried. I was like, are they gonna, is this gonna be too much for them? So the HLE2, and I welcome you to Google it. It's a assessment tool published by Dr. Rima Rudd and her colleagues. She's a health literacy, she's been around forever. She's a health literacy expert from, many, many years. And so, when looking, there's different assessments you can use. You don't have to use that particular one, but we liked it because it focused on 5 general areas, which were organizational policies, organizational practices, wayfinding. So that's another aspect like that. You don't even realize how important your signage and your ability to get to your, clinic or organization is. The culture and language, and then communication was the biggest area it covered. All sorts of, digital and print and AV, like all of types of communication. But let's hear from our panelists. What would you say, what else would you add about the HLE2?
I think for us, this is just very honest, we actually brought items or things to look at. So whether it was our website, whether it was the wayfinding, whether it was learning opportunities we provided for our staff, we really took a look big picture. I will say that we're implementing wayfinding in our new building that was just created, so that's really great. And then we are implementing more educational strategies for our member-facing staff.
For us, I think actually when we first met with Melanie to discuss the HLE2, a couple of us were like, well, I don't know, do we need to? But as soon as we started pointing out things that we need to do, like short-term, like taking all of our policies and putting them in writing, because we didn't have our policies in writing, they just started rolling off. And then we started talking about long-term things. And I actually started realizing that some of these, while we may have been looking at, getting them done with 6 months to a year, some of them were not just going to be done in 6 months to a year. Some of them were going to be ongoing things that we would have to do, not just in 6 months, not just in a year, but 2 years, 5 years down the road. And I think that was very helpful for our organization in helping getting our minds more organized and looking to the future as to what we plan on doing for our organization.
I hope that gives you some insight into the tool. Feel free to come find me, and I'm happy to give you more details if you would like. Any other questions out there? Or any comments? Anyone who was maybe part of the pledge program who is not up here on the panel but would like to make a comment about the pledge program, please, this is your time.
Yes.
The pledge program, was that also, y'all talked about the schools earlier, partnering with the school? How does that, can you tell me a little bit more about that?
So for the pledge program, we did not have schools participate. It was an open application process, so we would have loved to have a school participate, but we did not receive any applications. Going forward, we are looking at places like schools and public libraries, which are gonna, when you transform those organizations, they're gonna have a very far-reaching impact because they reach so many people. So again, hopefully we'll have another application process fairly soon, and we would love to have those types of organizations. And I guess we have time for maybe one more question, one or two.
Hey, no, I'll just make a quick comment because we were part of the pledge program at Texas A&M University San Antonio, and which I guess was kind of the closest to a school undergraduate. But and it was extremely, and although the instrument, the HLE2, is specifically for healthcare providing organizations, and we actually don't yet have even our student health center. However, one of the things, we do have a student counseling center. We have a lot of health and wellness initiatives in our HR program, and new degree programs in public health. And so what was really great about the process was, and the only other advice I would have is, we were able to sort of align, because it's hard to say, hey, we want to start a whole new initiative, and you get that look from upper administration, but a lot of times what we were able to do is there were already sort of initiatives like the President's Commission on Equity. They weren't doing anything related to health, but they were focusing on educational initiatives and so on. But we were able to get in there and just say, hey, that makes perfect sense, come on in. And so finding where this could align with pre-existing initiatives is one thing we learned throughout the process. And again, it helped us a lot with our websites, our dissemination of information, and our wayfinding and things like that. Do students even know how to find our food pantry and our student counseling center and things like that? So anyway, it was really highly recommend in all contexts.
Thank you, Ryan. And I think that is an excellent lesson learned, is to align with existing strategies. I don't know if anyone is here from SAM Ministries, but they decided in their participation they were going to align it with their current initiative to become a trauma-informed care organization. And then if they're here, they can say this, but I think they would say it worked really well to align it. And then if you saw Corinne on the panel earlier representing YWCA, she made the point that at first, they were having a hard time telling people outside of their health program that health literacy was important. But when she got her marketing person and she started coming to the sessions and realized, oh, well, this actually does impact everything that we do, whether it's our other social services or the other types of activities that we're doing. So I think broadening your mind maybe to how health literacy really impacts probably everything that you all do here in the audience. With that, I'm going to turn it over to Elizabeth to give us next steps.
Thank you, Melanie, and thank you to our pledge participants up here and out in the audience, and even those who weren't able to make it today. These people, y'all, deserve a round of applause. You've heard me say today, one of my themes, at least in terms of how I reflect on this project, is this project was a first in so many ways, and this pledge program was a first. They're too humble to say, so I'll say it for them, that implementing a pledge program in both health and social service organizations is a first. So this lady right here came up with that and ran with it with significant success. And we're just so proud of all of our participants, our PI, and all those who made it possible. So thank you and congratulations. And don't forget to contact Melanie to sign up for the next round when we get that.